Ladies and gentlemen, welcome back to That's So Fringy podcast. My name is Rick.
And I'm Kristin.
And as promised, we are back with another episode this week about the pharmaceutical industry, the medical industry, and all of the quote-unquote lies that we've been fed over time. For some of us, like we talked about in the last episode, when we go to the doctor, we just assume that those doctors have our best interest in mind and that they're there to take care of us. And what we find over the years is that that's not always the case.
Not usually the case.
Yeah, not usually the case. And there's a lot of underlying reasons for that. There's a lot of factors. A lot of it has to do with money. There's a system, right? Anytime that there's a system in place, it could either go good or bad. And Kristin's done quite a lot of research in this area. This is her lane, as we said before, being a nurse by trade. And so we're just going to give the microphone over to her tonight and allow her to just wax poetic about all the things that that she
quite
knows.
The intro there.
Yeah.
Well, I thought a good place to start would be, there's a million directions you can go with how corrupt the medical industry is. There's a million different things. Mm-hmm. So I thought that we could start with, I'm sure most of you have heard the term Rockefeller Medicine. So that seemed to be about when the medical industry changed, happened to be about the time Rockefeller came into play. So you can do a lot of research on Rockefeller. He was an oil guy. He was into the oil industry. And so he had like a monopoly on the oil industry. And so they told him, that's not okay. You can't do that. So they ended up splitting it up. And long story short, he bought a bunch of shares from other people. So he still was the majority owner in oil. So, but there's a thing that came out. So in 1910, a gentleman named Abraham Flexner published a report kind of on the medical system, and it was actually called the Flexner Report. So this happened in 1910, and before that, there was no agreed upon standards for most medical schools, but they focused on areas like electrotherapy, homeopathy, chiropractic, naturopathy, those kinds of things, because that was what we had to work with, right? We had natural medicines. So that's kind of, while there was no standards, that was what medical schools typically taught. So then enter Andrew Carnegie and Rockefeller. They ended up funding this endeavor with Flexner to essentially reform the medical community standards, starting in the medical schools. So the funny thing about Flexner, he doesn't actually have a medical degree. He has no medical degree. He's essentially just a guy kind of writing a paper. But he's bought and paid for by Carnegie and Rockefeller, which, if you know anything about that time, those were names that were very influential at that time.
Well, those that have the money get to make the rules, right? I mean, it's a story old as time, unfortunately. Yep. And that's the whole purpose in accumulating the wealth, is the ability to have the power to make the rules. And that's what these guys did. They not only had the wealth to throw around, but they had developed the prestige that, for whatever reason, people decided to follow them. Right.
So essentially, it's a 346-page report, but essentially it kind of goes through, hey, we're not going to do this natural medicine anymore. We're going to increase the number of prerequisites. So we're going to start adding things like English, writing English papers to medical degrees. None of that was necessary before. It was focused just on medicine. But his idea was, we're going to use science-based, in air quotes, stuff from now on. And so things like natural herbs and natural stuff, they didn't consider that science-based. So he strengthened, the regulations of medical schools, that kind of stuff. He also took most of the medical school most of those doctors. He took them out of patient care and put them just in classrooms. So instead of them doing the trial and error themselves on what is working, what is not, they kind of took that out and they made it just more of a paper-based system.
Yeah.
And same with the professors. The professors weren't really at that point dealing with patients either. So it kind of changed the way, whereas before it was a very immersive, you were dealing with the patients kind of nonstop. That was what you were doing. Doctors were taking care of their patients. Yeah. And, you see an influx in the nursing industry at that time, because now we've got to create an industry of people who can take care of these patients because the doctors are no longer doing it, kind of a thing. They were essentially keeping them cooped up with education so much that they, it's like missing the forest for the trees kind of a thing.
Yeah.
So the report comes out. Medical schools at that point kind of the number of medical schools went down drastically. But they also stopped. They no longer accepted women for the most part, most of them, because here we've made this new industry of nurses that the women can do. So they don't need to be doctors anymore. They can just be the nurses. So they no longer were accepting women for the most part, and they no longer were accepting people of color for the most part. It basically was white men that were allowed to be doctors, which is kind of still typically what people think of when they think of a doctor. They think of a white man. I mean, that's kind of was all by design. But
it's wild how they can do that, right? How they can just like change the rules and be like, oh, we're not accepting women anymore, and we're not accepting any other races. Like, what? Like, these people don't know how to practice medicine. They can't learn how, just like the white men. No, obviously not.
Yes, obviously not.
It's so weird.
Right. So at medicine at that point, which is kind of how I see it now, medicine at that point became profit driven. It was about the money. That it was no longer about the patient care. It was about the initials after your name and how much money you could charge people to see a doctor.
Yeah.
And so Rockefeller, he had a lot of interests in oil companies, obviously, but he realized at that point, if we can do away with natural medicines, which can be costly because, you've got to grow the stuff, you've got to harvest it, you've got to take care of it, you've got to sometimes make these tinctures that take a long time to, fester and do their thing. So it was a little bit more costly, obviously, to do natural medicine, but he decided at that point that he could use his oil-derived compounds in a lab to make the pharmaceuticals. So that's kind of
sketchy.
Yeah. So he's got a high interest in the oil company, and now he's decided he's going to use oil-derived products as pharmaceuticals. So,
as they say,
thus begins Big Pharma.
Follow the money, right?
Yep.
And you'll figure out why we are where we are today.
Yep. So another piece is Abraham Flexner's brother, whose name was Simon Flexner. He was actually employed by the Rockefeller Institute for Medical Research. So they were buddies. And then Abraham Flexner later on became the first director of the Rockefeller philanthropy programs. So they were buddy, but I'm sure he didn't have any reason to take this Flexner Report and make it the new standard. Probably not.
Yeah. And then it's like these philanthropy programs, they give the money to certain people that are going to further the agenda, right? It's not like they're just picking some family off the street that is in desperate need or something like that, or they're not going to the local churches and being like, hey, where are your guys' needs at? And we're going to start funneling money into those. No, these are like the beginnings of the lobbyists, right? The people that go to those that make laws in our nation and say, hey, we're going to give a bunch of money to your campaign. And then you can, make some rules that are going to help, cure lots of diseases, and they're going to help to make people feel better. And this money's going to be well spent.
Yep. So then it makes you wonder, like, why would anybody follow this report? It's just a report from a random guy that's not even a doctor. Like, why would we follow this report? Well, if you think about what was happening at that time, you had the two wealthiest conglomerates. You've got Carnegie and you've got Rockefeller, and these guys have the money, basically. So what ended up happening is they had a police presence at these universities that was basically making them enforce this program. It was a complete reform of the medical program. So they actually used the law enforcement to go in and basically tell these people what you can and can't do anymore.
That's so wild to me that you can you could just use the police department to come in and you know, and these aren't, like you said, it's not even law. There is nothing for the law enforcement personnel to enforce other than, you know, a little bit of shady money exchanging hands in back alleys or something like that makes them want to, we'll enforce these things. Like there's literally no reason why they would do that other than some sort of personal incentive. Right.
That's exactly what it was.
It's crazy.
Those that have the money. So we started this around 1910 when this Flexner Report came out. And then in 1997, the World Health Organization actually adopted the Flexner Report and extended it worldwide. So now this random report from 1910 from a gentleman with no medical background is now adopted by the World Health Organization and implemented worldwide in 1997.
And the World Health Organization, I mean, come on, they're a joke. I mean, they're basically just there for hire, really. I mean, this just goes to show you that when people say that they're experts in science or in pharmaceuticals or in any area for that matter, you really need to check that. Like just because somebody says that they're an expert, you know, back 5 years ago now, we're kind of on the anniversary of this whole COVID thing starting up. It was this week about 5 years ago that everything began to be locked down and mandates and all of those different things. This is when they said this is now officially a pandemic, and it was the World Health Organization that actually said that. You know, they put that out for the whole world. And so it's very interesting that we are doing this, and we didn't even really set it up that way, but it works out.
It just happened to be
that we're talking about this on the 5-year anniversary of the experts, right? Saying this is what you have to do. And then as we continue this might be a couple part series. But as we continue to go down this road, we, you know, with hindsight is 2020. We saw in 2020 that there was quite a bit of, slyness going on, a lot of making stuff up.
And it does bring you back to that Flexner Report, because this guy just went in and gave his opinion. That's basically all it was. He was like, I don't think we should do it this way because we have these oil-derived products we can use now, and it's a lot cheaper to manufacture. So let's just do it that way. And he basically writes this report, and now it's the same thing as like Fauci did, where he's like, you got to stand 6 feet apart. And then he admits later on, last year or whatever it was, that it was literally an arbitrary number that he just made up.
Yeah, I just made it up.
He just made it up. There was no scientific basis for the 6 feet ever.
Ever. Yeah.
So, yeah.
It has nothing to do
Big
with
Pharma and the medical. Right. Well, there's that. The medical industry. So, in the U.S. spent $4.4 trillion on healthcare in 2022. God. As of 2019, because we wanted these numbers before the pandemic started, just because those kind of could pad things a little bit. But as of 2019, Pfizer was the most profitable healthcare company, coming in at $6.3 billion. And then followed closely behind with Johnson & Johnson coming in second at $5.1 billion. That was before COVID. So those numbers are drastically higher now after all this. Obviously, because Pfizer became front runner, Johnson & Johnson became front runner. All of a sudden, these are household names where before 2020, nobody barely knew what Pfizer even was, what they did.
Well, and to be clear, Pfizer has never cured anything.
Right.
Like, so they're making all of these pharmaceuticals and vaccines and all these different things, but they've never really cured anything. They've just been making more and more pills and more shots and all of those different things. It's well, wild to me.
You look at these, like the Rockefeller. They fund a group called the American Type Culture Collection, which was founded in 1925, and it's basically a distribution center for cultures of microorganisms. So basically somebody says, I want to study this virus, and they send it over there from this place. And it's Rockefeller funded. In fact, there's people, I don't know how I felt about this part of the research. I couldn't really get a good lane either way because there was good evidence on both sides. But they're saying that this American Type Culture Collection place actually created the Zika virus, and that was where it originally came from and got released from there. But again, you never know, so I don't want to say that as fact. I'm just saying word on the street.
The word on the street is, we could say that for a lot of these different diseases that are out there. Like, how many of them have been man-made, whether it's been accidental or on purpose? We're not naive to the fact that there is, secret agencies and
weapons.
Weapons manipulation and trying to weaponize these type of things. Yep. There's outbreaks all over Africa that don't make any sense. They don't make sense as natural things. And there's been lots of that throughout the years. And so I wouldn't be surprised by any means.
I wouldn't be either. So the Rockefeller Foundation ended up not just sticking in the lane of the medical education field. They have a lot, and education in general. They ended up, and we'll do a whole separate thing about the education system and how the Rockefellers were fun partners in that. But we're not going to get into that on this one. But his idea was, if you control the schools, then you control the indoctrination, which, again, our last episode, we talked about propaganda. Yeah. If you control the schooling, then you control the propaganda that's allowed to reach your children, your young adults, it's pretty sick when you really think about it.
Well, and that goes for schooling, for medical school too.
Correct.
They're not teaching in medical school, like, I don't know, nutrition. Like, they don't teach nutrition.
It's a very small section of what they teach. Yep.
Yeah.
The biggest section when I was in nursing school that was the most strenuous, I would say, was the pharmaceutical part. Was learning all the different drugs, what they do, what the dosages are. That was a big part of nursing school. Yeah. In fact, I think we had it three or four out of 5 terms in a row. We had it. It was a lot. So there's a quote from John D. Rockefeller, and this should scare the daylights out of everybody. And I'm sure you guys have heard it before, but this quote says, quote, "I don't want a nation of thinkers. I want a nation of workers." So if they give you this education system and indoctrinate you that way, then you're not allowed, or you don't need free speech anymore. You don't need to be a free thinker. You don't need any of that, because they're telling you exactly what to think and then how to treat the patients with it. You saw this come into play with COVID, big time.
Yeah, big time.
People took a vaccine that didn't even prevent the disease.
Yeah, there was no questioning.
Right, there was no questioning. There was, I would say, if you're looking at this quote, we were definitely not a nation of thinkers during that whole pandemic. But by and large, the thinking was out the window. People took this vaccine that didn't prevent the disease in the first place, so that didn't make any sense. And then some would argue it made it worse because you ended up getting it even more. Most of the people that I personally know that have gotten the vaccine have gotten COVID at least 3 or more times.
Oh, yeah. Yeah, it's pretty wild to think that, all of the mandates and all of the things and all of the boosters and all of that stuff, and they're still scared about it. Like
Yep.
it's still a problem. It's like
Yep.
if that stuff was supposed to work, then why is it still a problem?
Right.
I mean, all you have to do is just start applying some simple, very basic logic to these things. But going back to that quote, that's not what they want you to do.
That's not what they want.
They don't want you to apply even the base level logic at it.
Right.
But if you did, you would find that, wait a minute. So you want me to take this and then this many boosters and stay 6 feet apart and wear a mask and all of these different things, but I'm still at risk? Like, how is that possible?
Right. And how is that something that you just sign up for? Like, yeah, I'll do that. It's not going to help me in any way, but I'll do that. It's
like we talked about on the last episode, it's that mentality that they're in charge,
right?
That they are an authority. I mean, how many times did you hear trust the experts
and trust the science?
Yeah, and trust the science.
Because guess what? We go back to Flexner Report. 1910 is when they said we're going to switch everything to science-based.
Yeah, we're going to start trusting the science from.
But if they're skewing the science and if they're flat out ignoring the science, then what is it based on? It's based on nothing. It's based on a guy that doesn't even have a medical degree.
Yeah. Have we ever stopped as a nation or as a culture or as a people and asked ourselves, what type of science are they doing?
Right.
Not only that, but if you want me to trust it, then let me see it, first of all.
And let me see accurate numbers. Let me see let
me critically go through it.
Yep.
But then also, who's funding the science?
Right.
That I'm supposed to be trusting. Because if like I said at the beginning, if we're to follow the money, then I want to know who's paying for this science that you want me to trust, because a lot of times that's going to sway my decision, because I know that, there's some shady dealings going on.
Yeah.
And I want to be sure that, just because you say trust the science doesn't mean I trust the science, the backers, and all of that. I have some questions.
I have questions.
Yeah,
Excuse me.
I have questions.
So let's go through some of the standard medical practices that are weird. Now that we know what we're looking at a little bit more. So we're going to talk a little bit about Tylenol, fevers, that kind of thing. Before antibiotics existed, right? They actually used to take victims that had a severe infection, a bacterial infection of some kind, and they would treat them by inducing a fever. Because your body's response to the fever is what kills off, and the temperature. A lot of these fevers, they actually protect your body. They stimulate the immune system to target and damage the pathogens, right? And most of these pathogens cannot survive in higher temperatures, which is why you see a temperature of a clinical temperature of 100.4. That is the temperature at which these pathogens can no longer survive.
Yeah.
So they would take these patients and they would throw a fever at them, and it would cure this bacterial infection. And now we have antibiotics now, which we can, have another episode on antibiotics, because good grief, that's the whole thing. But there was actually...
they want you to get rid of the fever as soon as possible.
Right.
Like that's what they tell you now is like, oh my gosh, fever is bad. We want to get rid of it as soon as possible because, you could get brain damage and all of these different things. And so then we take like ibuprofen and Tylenol and all of these things to bring that stuff down. Like instantly.
And there was a Japanese study done and they discovered that giving antipyretics, which is that, anti-fever medication, it actually worsened the bacterial infections in children. And then there was another study separately that found that in babies with severe infections, a lower body temperature actually translated to a higher mortality rate. So the lower their temperature was, the higher the chances of them dying were. I mean, and these are studies that you can't, that they happened. And it actually makes perfect sense when you're looking at it that way. Fevers are not caused by the infection itself. A fever is the body's natural response to the infection.
Yeah.
So your body's natural response is to send this 100.4 temperature to kill off this stuff. It's the same reason that we cook chicken to a certain temperature, we cook beef to a certain temperature, and they're all a little different. Because why? Because we know the pathogens that are in pork need to be heated up to a little bit higher temperature than those of beef. That's science. And it's the same thing with the body. You gotta stop treating these fevers. Because one of the, like you said, one of the biggest things is people said if you have a high fever, it can cause brain damage, right? It can cause seizures, it can cause brain damage. There's a very, very, very small percentage of people that can get a febrile seizure, but it's not many people, and they don't lead to any long-term brain damage. So there's studies that have found they don't cause, turns out, fun fact, they don't cause brain damage. They don't cause seizures. There's no evidence to suggest that antipyretics would prevent a febrile seizure anyway.
That's so wild.
Where did this all come from? Well, it came from oil-derived pharmaceutical products.
Yeah, and trust the science.
Yeah. I mean, you look at Tylenol, most people think Tylenol is just harmless. It's just a medication that's going to reduce your fever, help you with your pain a little bit. There's nothing wrong with it, but it actually depletes the body of glutathione, which is an antioxidant, a very powerful antioxidant. It's the leading cause, listen for those in the back. It's the leading cause of liver failure in the United States. Leading cause.
The Tylenol.
It increases the risk of ADHD when you use it in infants. There's been studies that have shown that you're much more likely to get ADHD if you've been given a lot of Tylenol as a child.
You must have had a lot of Tylenol as a kid.
I definitely had a lot of Tylenol. For sure. Not that I have ADHD or anything. But
no,
squirrel.
Just saying.
Yeah, just saying. It also, there's been studies done that prove that it increases the risk of asthma in young children. Because again, asthma being a bacterial infection in your lungs, if you're giving Tylenol and reducing the fever, it's not able to clear out that bacteria. So you're always going to be more prone to having asthma.
Yeah. So, I
mean, natural alternatives, obviously, when you have a fever, you're going to feel a little bit like garbage. That's just part of it. But you can do stuff like, obviously, extra hydration, cool rags. You can do Epsom salt baths, homeopathic remedies. One of them was called belladonna, and the other one was ferrum phosphoricum, which either of those you can get them from a naturopath, or you can get them, you can order them online.
Yep.
Herbs like elderflower, peppermint, yarrow, that kind of thing also work really good for fevers, but stop treating fevers with Tylenol. The more research I did on this, the more I was like, I don't think I ever want to take Tylenol again. I think I'm just going to go ahead and get that out of here.
Well, and that's the go-to, right? I mean, if you were to go to a hospital and have a fever, that's the first thing that they're going to give you.
Well, and before when you take your babies in for a well baby visit, they say give them Tylenol or ibuprofen before you bring them in, because we're going to give them their vaccines and they're going to get a fever. So they want you to treat that before you've even introduced anything to the child. Just give it to them ahead of time so it's already kicked in.
You realize what you just said, right? We're going to give them a vaccine, and then they're going to get a fever.
Exactly. Yes.
So you just got done saying that the fever is not the illness, it's the response to the illness. So when you give them a vaccine, are you giving them an illness?
Yep.
So
it's the age-old question. Some of them you are.
It's crazy. You're just injecting yourself with problems that don't need to, in order to be a precaution against something that may or may not happen later on down the road. Right? You're saying maybe you're going to have a problem with this, but we're going to make you sick now.
Right.
Just in case.
And then, I mean, so, Bethany hasn't been able to carve out time to come back on the show because she's got a very, very busy little toddler now.
Yeah.
But one thing that I really recently went through with her was when she gave birth to Malachi, which was a little over a year ago. And she had to fight the hospital on so much stuff. I mean, she had to fight them on, I don't want him to have a vitamin K injection. I want the delayed cord clamping. I want to have, I don't want to do the erythromycin in their eyes. So we did a bit of research on that erythromycin that they give to babies. So every single baby that is born, unless you specifically and multiple times to multiple nurses tell them, I don't want the erythromycin in their eyes, every baby is getting this. So we go, why? That doesn't make any sense. Well, 10% of babies began developing these eye infections kind of, pretty soon after delivery during the 1800s. So this Dr. Carl Creed character, he discovered that this is linked to babies that are born to mothers with gonorrhea or chlamydia or some kind of bacterial infection that they've got going on. So he used silver nitrate to treat the newborns that were affected, right?
Yeah.
So now we've switched to giving an antibiotic, which is not silver nitrate. Silver is a naturally occurring substance that you can use to treat bacteria. So instead of giving them silver nitrate, if they have this infection, we now treat every single child that's born to a healthy mother who's been tested for all of these bacteria and does not have them. And we still put the erythromycin, which is an antibiotic, in their eyes.
Jeez.
Literally, like sometimes within minutes of them being born, they get that stuff put in their eyes.
It's like NASCAR. They take them over, they clean them up, they wipe that stuff on their eyes, they do all that stuff really quick. And if you're not paying attention and you haven't already, been very specific, like you said, multiple times to multiple people, they'll just do it out of habit.
They'll just do it.
Yeah.
Yeah. I mean, I remember 2 or 3 times they brought in the tube of the erythromycin to put in his eyes before reading the chart, and then a couple of them caught it, and a couple of times we caught it. We decided that we were taking turns. None of us were going to be sleeping all at the same time because we didn't want anybody putting anything in that baby that we didn't explicitly agree to. Yeah. So we had Bethany, we had my other sister Jennifer, we had my mom, we had Rick, we had Robert, we had everybody there.
On duty.
Like, hey, we're not going to. And same thing with, she didn't want to give him a bath right away. Because all that vernix and that stuff that comes out with them, why are we wiping that off right after they're born? We're taking all that protective membrane and just discarding it like it doesn't matter. Oh, this is just an ugly thing that we're gonna. So what we did, it's icky. As a baby or as a family, is we just took that vernix and we rubbed it in, and he didn't get a bath for 3 days because he didn't need one. Yeah. And all that stuff was allowed to then soak into his body. All of that, the reason that they give a vitamin K injection after babies are born is to help clot their blood, right? Because their clotting factors, their livers are still getting used to processing on the outside. So they give them the vitamin K to help them with clotting. However, what they have found through studies and science is if you delay clamping that umbilical cord, they get those clotting factors from the umbilical cord. So if you clamp that sucker right after they're born, what happens? All those clotting factors that you need in your blood, they're in the cord. Yeah. They're not in the baby. So we waited and didn't clamp the cord for, what was it, like an hour, I think. We left the cord attached until you basically leave it attached until it turns white. You shouldn't ever see any red or any blood left in that umbilical cord because that's every ounce of that is supposed to be going to baby.
Yeah.
Anyway, that was my soapbox on that.
Well, that'll take us down a whole nother rabbit hole that we can do on another episode on what they're doing with those placentas and all of that stuff afterwards.
Yeah, well, definitely. We can go down that road, but that's a dark road. It's a dark road to go down.
Yeah, we're going to keep it a little lighter.
Yeah.
I mean,
so
when you think
in
about
the risk,
stuff,
when it ends up being the risk of the baby getting any type of infection at birth is less than below 0.01%. So thinkers would think, let's just treat the babies that get infected. Let's not treat all the babies. That doesn't make any sense.
Yeah, but like you said, they got tubes of that stuff.
Oh, it's everywhere.
And there's a reason why, because that stuff, and where does that stuff come from, and what is it made of, and what else does it have in there? And, you go down these really dark roads and you begin to find out that, and I don't blame any of the nurses or any of those people. I mean, some of them I do, because they're very combative when you ask them not to do something. Those ones I blame. But when you ask somebody not to do something and they're like, oh, okay, no big deal. Yeah, we don't have to do that. There's some, you can tell when there's a thinker versus a robot, somebody that's like, no, we have to do it this way. This is the way that we always do it.
Right.
And when you get somebody like Bethany and yourself, when you come in there and you're like, no, I'm not doing that. We're not going to inject all of these, shots into my baby. We're not going to do the vitamin K. We're not going to do any of that. It like triggers a response in some of these people because it's so embedded in their everyday procedures. This is a procedural thing.
And they've been conditioned to think if you don't do this stuff, you're harming your baby.
Yeah.
They're not conditioned to think this stuff could be the harm.
Right.
They're thinking by not giving them the antibiotic in their eyes, like you're harming them. Well, no, you're not.
Yeah.
If you wait until that 0.01% actually get an infection and treat it right away, there is no harm.
Right. With silver.
Right.
Silver nitrate, not with goo in their eyes.
Not with goopy. Yeah. We that was just one of the things recently that we went through that was kind of more of a personal side. But getting back to the subject at hand, I'll get off my soapbox now.
Okay.
So we're going to look at polio. Okay. So polio was a big deal, right? Polio this is what we've been told. Polio is a virus that's found in your gut. It's known to be life-threatening because it causes paralysis, can cause severe paralysis. So here's the real statistics on polio that they didn't want you to ever find out. But about 70% of people that have polio have zero symptoms. You don't even know that you have it. You don't get sick. You certainly don't get paralyzed. So 70%, the majority of people don't actually have any symptoms from polio. There is about 25% of people that experience kind of like a flu-like symptoms. Just a general malaise, general not feeling well. 1 to 5% experience a very temporary paralysis, which is your body's natural response because these people have the flu-like symptoms. So typically they would have a fever. And this temporary paralysis is your body saying, lay down.
Yeah.
Lay down and let me do my job. Let this fever do its job. So that temporary paralysis is not permanent. There is like less than one. Coma. Right. Yeah. Which is sometimes, they induce a coma and a brain injury to let your brain rest, to let your brain heal itself, to let your swelling come down, all that kind of stuff. So there's actually less than 1% of people experience permanent paralysis. Jeez. But yet we vaccinate the entire healthy population. We vaccinate them for this less than 1% with permanent paralysis. Now, some people can argue if that was your kid that had less than 1%, maybe you'd have a different story. So I understand that point of view also, but
I would also argue, what is the polio vaccine doing? Do we know? Right. Do we know? Like we said, you're giving them something that sometimes is a live culture, so that they can have a better chance, but their chances are already pretty great. Pretty great, right? Yeah, pretty astronomical.
There was actually an investigation. I think it was in the late 50s, like 58 or something. There was an investigation that they did in Detroit for polio patients that they were vaccinating and treating for polio. So they're actively treating these people for polio, and only 51% of them ended up testing positive. 49% were negative. So they didn't even have polio to begin with. They probably had a mild cold or something, and they were like, polio, gotta treat them. It's just crazy. They ended up finding later on that paralytic polio cases were actually linked to arsenic poisoning.
Oh, okay.
Yeah, arsenic poisoning and exposure to DDT. Geographically, if you're looking at it geographically, these cases were concentrated in areas that were sprayed with arsenic on sugarcane crops to kill the weeds. So DDT, which we know ended up causing a lot of problems later on for a lot of veterans.
Yeah.
These polio cases were in the same clusters that they were treating the sugarcane crops with arsenic and DDT. Interesting.
Yeah.
Arsenic, fun fact about arsenic.
Problem.
Yep. And could then create the solution.
Yeah.
Arsenic is toxic to the exact same cells in the spine that polio attacks. And fun fact, arsenic also damages the lining of the stomach. So they're saying polio is kind of harbored in your gut. Huh. So is arsenic. Interesting. Probably no connection.
Yeah, probably not. I mean, I don't see one. What are you talking about?
Yeah. So DDT it's actually a synthetic insecticide. It's now banned in the US, but symptoms of DDT poisoning as well as arsenic are identical to the symptoms of polio.
It's wild.
And countries that are still using DDT, that are still polluted with it, those companies continue to have high cases of polio, even with vaccinations.
Yeah.
Now, what do we think it's really polio, or do we think it's possibly caused by these other environmental things?
There's a lot of that. I mean, when you talk environmental, or also what's in the food, what's in the plants that we're eating,
in the water.
What's in the water, all of those different things. What have they sprayed? What have they sprayed in the atmosphere? What have they sprayed on our plants? You know, a lot of the illnesses and the things that we have are from these chemicals. You know, these chemicals that make things sit on the shelf longer, or give them an opportunity.
Or give them color. Something as silly as give them color.
Yeah.
We want Kool-Aid to have the red 40 because it makes it look cooler. See what I did there?
Well, it needs. Yeah, I did. It was borderline funny.
It was borderline. That was like, instead of LOL, it was LSTM. Laugh softly to myself. Yeah,
exactly. But yeah, I mean, what they don't realize is these dyes, these sprays, all of these different things. They realize it. Obviously, they know. Right. When I say they, we know who that is, right? They know, but they're not telling us that, because what happens when the mass public finds out about that stuff? Well, we go into an uproar like we do, like when we found out that all of this stuff was a hoax 5 years ago. And to go
back to Rockefeller's quote, he doesn't want us to be thinkers. They want us to be workers. They don't want us to be thinkers. Why would they give us this information? Then we might think about it. And then we might think about whether we want to put this stuff in our body, in our air, in our garden, in our houses, Yeah, I mean,
if the news came on and actually was telling the truth for once, and they were going through and they were saying, hey, this is discovered, this is real science, red 40's bad, dyes are bad, most of this food that you're eating is bad, we've been spraying things all over your plants for a very long time, and all that stuff's causing you. Oh, and by the way, the vaccines that you've been taking and the over-the-counter drugs that you've been taking, those are also harming you in these ways. Like, the mass public would stop buying all of that stuff instantly. We would all be like, oh, you're poisoning us from every direction. We're going to stop buying it all. And then what would happen to their product, their profits? So you have to hide it. If you are doing something shady or nefarious, you have to do everything that you can to hide it. And I feel like this, what Rockefeller was doing at the beginning was giving them some sort of ability to shield. This is the beginnings of this gigantic, long thought out hoax that was going to go on for a very long time. And he probably couldn't even have imagined how big it was going to get.
Probably in his narcissistic mind was hoping that's how big it
I'm
was.
Sure. But, it's gotten so incredibly out of control that it's almost one of those things now where you can't turn this ship around. It's too big and it's going too fast. All you got to do is run, get out of the way.
Yep. Yeah, I mean, even with the COVID vaccine, or whatever you want to call it, because a lot of people get up in arms if you call it a vaccine. It's not a vaccine. It's an experimental trial. Whatever.
It's a bioweapon.
It's a bioweapon. Which it probably is, but for all intents and purposes, we're going to call it a vaccine, because that's what we have to call it right now. But studies actually show that the vaccinated patients died at almost 2 times the rate of the unvaccinated.
Yeah.
I mean, I from my own experience, I think I've told this on this show before, but I'm not sure. But when I had COVID, I ended up in the hospital with it. mostly because I had a raging urinary tract infection that I didn't know about. So I was septic from that. So then when I got the COVID, it made it worse, but ended up in the hospital with the COVID. And they were treating me. Well, first of all, they wouldn't let Rick in with me, which was a big deal because I was actually like hallucinating and seeing things. I was so infected that I was what was it seeing? I saw a meerkat on my IV pole. Very cute meerkat.
Right.
I saw a professional soccer player in my bathroom. So, but I had no idea how to use my cell phone. I was holding it in my hand and looking at it, and I had no idea how to use it. I couldn't call Rick until somebody finally came in. I couldn't figure out how to use the landline, couldn't figure out how to use my cell phone. Somebody finally, I think, used my cell phone to call you. It was like
Bethany
a nurse.
and I were working on it from our end, trying to get in.
Right. So they were trying to get somebody in.
Persistent.
Yeah. They were like, hey, you know this lady that you have in your hospital bed right now? Well, she's a nurse. And if you do stuff to her that she doesn't agree to, there's going to be hell to pay.
Yeah, we started talking about lawyers and consent.
Yeah. You start talking about informed consent and they get real nervous.
Yeah.
So they ended up letting Rick in, though, but not after I'd gotten a dose of remdesivir, which would be a whole nother episode on remdesivir and what that did to people. But and then the next day I got a second dose of the remdesivir, and Rick was like, hey, can we start doing some like heavy duty vitamin treatments? And they were like, well, we can give you the recommended dose of vitamin C. And he's like, no, we need like high doses of vitamin C and zinc. And I don't remember what all it was, vitamin D.
Yeah.
And they refused. They would only give me the little tiny pill that was just the like over the counter, what you can buy at the store, nothing crazy.
Well, they
wouldn't put it in my IV.
This is the protocol. Protocol.
Right.
And so I ended up taking her off of the remdesivir and saying, we're not doing that anymore.
Well, because I ended up in kidney failure overnight. Yeah. After my second dose of the remdesivir, I ended up in, I have not felt pain like that before. My kidney on the right side was completely shutting down. And so they came in and did ultrasounds. They were like, what's going on with her kidney over here? And Rick was like, thank God. Rick was like, let's hold off on this last dose of the remdesivir. I don't feel good about it. So we ended up, did we smuggle in vitamins?
I ended up making them give you a bag of vitamins.
Yeah, because on the third day.
An IV big mixed vitamin bag.
Yeah. And it was it was actually one nurse that was from out of town. She was from somewhere on the East Coast, and she was over helping, and she was would listen to us, and so she got it cleared through to give high doses of zinc and vitamin C. I think those were the two that they would give. And so by day 4, I was up walking around feeling like so much better. I wouldn't say $1 million, maybe $100. I maybe felt like $100, but
25 cents.
25 cents. So I was out walking around in the hallway with Rick, and we were kind of doing laps because we couldn't leave the unit. We couldn't go anywhere. So we were kind of doing laps. And I swear the doctor that opened this little side door that's like, I don't know, goes to a bunker or something. He comes out and looked at me like he'd seen a ghost. Like, I can't believe you're up walking around. And I'm like, I'm ready to go home. Like, what do you mean? I can't believe you're up walking around. I'm ready to get out of here. And he was like shocked.
Yeah.
That I recovered that quickly just from the vitamins. We stopped every other medication and just did vitamins.
Yeah, because everybody else on that unit was going downhill fast, but that's because they were on the protocol. Yep. And that just goes to show you that sometimes they don't always know what they're talking about. And so it's unfortunate to me that you have to get so heavy-handed with them.
Right.
I mean, Kristin can tell you, I've been very heavy-handed with some of these people at the hospitals, whether it's a diabetic educator or anybody that has anything to do with Kristin. They have to hold themselves to account because I'm asking every question and I'm all in their business. And if something doesn't make sense, I make them explain it to me until it does, and it usually doesn't. And so if it doesn't, then they don't get to do that thing. And there's been many times where, I've signed away, any type of liability or anything like that. And I just said, I'm taking over. This is what you're going to do. And if not, then we'll just get out of here.
Right.
And we're just going to leave, and I'll deal with it at my house, because, we firmly believe that God is the creator, right? And
the great physician.
Yeah. And the great physician. And there is a certain reason why these things work, why your body goes into a fever, why the stuff that we were talking about with Malachi and all, the stuff all over his body, and all of that stuff is there and functions and happens for a reason. And the more, I'm convinced that this is what Rockefeller and those guys wanted to do, was to completely get rid of God's system, and create a man system, a beast system, if you will. And when you create the beast system, it's completely different than, what God had originally authored. And when you change that, that's when people get sick. That's when people die. That's when things happen that make you have to go to the hospital over and over and over again. And some of these things are not reversible. She went into kidney failure, but then luckily she bounced right back, and there wasn't a lot of long lasting damage. But she also, in a different way, lost her pancreas back when she was 20. And so now she has the lasting effects of that by being a type 1 diabetic. And so it's like some of these things that we're doing, whether it be a vaccine or a medication that we're giving to our children or whatever, like with autism in Lincoln, some of the things are reversible, or can be treated and helped. Some of these things, and this is why we're pretty passionate about it, is a lot of these things, I should say, are irreversible.
Yeah.
They have irreversible effects that you have to live with for the rest of your life. And so when you take that medication or you do that thing, maybe whether it's a vaccine or whether it's, all of the vaccines that a child has to take before age 2, what is it, like 72?
71. Children in America have to get 71 doses of vaccine. And there has never been, repeating that for emphasis, there has never been a double-blind, placebo-controlled trial to prove that any of them are even safe. In the existing studies that they have right now, they don't use saline for the control group. They use a different vaccine, or they use a different version of the same vaccine. So they call it a blind study, but it's not, because they're not giving the control group saline. They're giving them something.
Yeah.
So that's not a double-blind placebo. I'm sorry, that's not. There's over 100 papers that have shown that kids who are vaccinated are more likely to experience chronic illness and autoimmune diseases.
Yeah.
Got both of those.
Right. Congratulations. You win.
Congratulations. You win.
But I mean, that just goes to show you that, we can't mess around with this stuff.
Right.
For too long, we have been the people that don't think. We don't critically think. We've don't ask questions. Workers. Yeah, we've blindly, like anybody in traffic, they'll be like, I'm just going to sit here and be in traffic. And you can be in traffic for days, but there might be somewhere where you can pull across to the other side and get out of there. Or
pull over and realize there's a tree in the middle of the road. Let's just move this tree and then everybody can go.
Yeah, I mean, sometimes you just have to use your brain, and you can't just be this group of sheep that are just walking ourselves off the cliff. Right. And, you have to be the one sheep that looks up and looks around and says, wait a minute, why are we doing this?
Let's stop.
And I feel like here in America, at least now, we've got a lot of people that are beginning to wake up to this. We're not the only podcast that's talking about this, not even by a little bit.
Right.
And, we've got this new health secretary, in RFK Jr., who's very much about, against the vaccines, very against all of these things, and, love him or hate him. Hopefully you love him. He's looking out for people. And I don't know how you get mad about that, unless he's taking away your money, in which case I would say, oh, that's why you're mad. But if you're making money,
and that's what we've been doing up until now, is people have been taking our money and just deciding on these arbitrary rules. I mean, Malachi doesn't have a single vaccine. He has not been vaccinated for anything. And we were weighing him ourselves and calling the doctor's office. He's only been to a doctor once.
Yeah.
For like 6 weeks. It was like just a checkup for a new baby checkup. And he sees a natural doctor and they did nothing. They were like, cool, he looks healthy. Everything looks great. Keep doing what you're doing.
Yeah, maybe on the next episode, we'll get into the financial side of this.
Yeah.
Because we could probably do 3 or 4, maybe even 5 of these, just talking about all of the different things that are wrong, all of the different things that are like, tetanus shot. I was just reading about this not that long ago. Everybody wanted, they wanted to give you a tetanus shot.
Every 10 years.
Come to find out, it's naturally sterilizes people. It actually has a natural
I bet that's in the fine print somewhere.
Effect. Yeah.
Wow.
And so then you walk down that road and it's like, do you really need the tetanus shot? Or is that the goal? It was the goal, the sterilization the whole time.
Well, when they switched in 1910, when they switched over to a medical system run by money, run by oil tycoons. I mean, what do these oil tycoons, what do they want with the medical industry anyways? This is not their lane.
Right.
But they had the money, so they could make the rules, basically.
Well, and they're greedy. They want more and more and more money.
Absolutely. It's never enough.
And see, it's people like me that don't understand that. I understand being poor. That's pretty much what I've understood my whole life.
Right. Yep.
And so I've never had the trappings of being extremely wealthy. And maybe if I was coming at it from that angle, I would understand a little bit more this extreme greed where people always want more and more and more money. But I come from poverty, so it's like, I always say to people that, when you talk about people with a lot of money like Jeff Bezos, I always say, I don't understand how Jeff Bezos even wears pants anymore. Like what?
You don't need to.
You get to the certain point where you have billions and billions and billions of dollars. It's like, what are you? Why are you still?
Why are you
working?
Getting up in the morning and going to a job?
Like what? You could be doing so many different things. I mean, we were created, in my opinion, because I believe in the Bible, we were created to, discover, explore, have relationships with other people, like we could mountain climb, we could ski, we could, float the river, raft, like skydive, like there's all these different things that you can do, but you're getting up every day, bro, and putting on a suit and going into an office to just further this greed because you just can't get enough. And maybe it doesn't necessarily, after a while, have anything to do with greed. Maybe eventually it becomes the pursuit of power, that pride that begins to take over, where you just, now the power is so alluring.
And how dangerous is that? Money and power. Those are the two things that you crave. Oof.
I mean, this is how we've gotten to where we are. Why our food is poisoned. Why our medical whole industry is the way that it is. And there's so much more. I mean, we could keep going here, and we can, but I just wanted to make the point that we've gotten so far away from God's system. And the more that we go back towards God's system and like learn what the body really how it really works and why it works that way, we begin to realize like, oh, this is all just a design that if we did that, then we'd be fine.
Right.
But now we're fighting this beast system. We have to, you have to tell a nurse 4, 5, 6, 7 times, don't give him the ointment. Don't do it.
Right. And we ended up getting into a little kerfuffle with the staff because they would not do his circumcision without giving him some vitamin K. That was the one thing their policy would not, try as we might, would not, they basically said, we're not going to do his circumcision unless we give him the vitamin K.
Yeah.
Even though we did the delayed cord clamping, even though we had all of the, evidence-based paperwork, we had everything we needed for them.
They refused.
They refused. And so in order for him to get circumcised, they did agree to give him a half dose. So that's the only thing he's ever had was a half dose of the vitamin K.
I mean, I said I would do it for free without it, but
oh my gosh,
they didn't take me up on it.
Rick's garage circumcision.
I had my K-bar out. I was ready.
Seems legit.
So
the last thing I want to talk about, which is it's a very touchy subject for a lot of people, and I'm sure most of you have had this, either personally touch you by a friend or a family member. But and this was one that was really hard for me doing this part of the research. It's talking about SIDS. Mm. So SIDS just randomly overnight became a thing, sudden infant death syndrome, and they couldn't explain it. They didn't know why. It's like this, just such a tragic, and it usually happened between 2 weeks and 8 weeks, I believe, was the time frame that it was like really prevalent. And then of course up to a year, up to a little over a year, actually, I think it's 14 months. Yeah. So there was a gal, she was a police detective, and she kind of got her ears perked up a little bit because she was doing all these investigations of these infants that were dying of SIDS, right? Mm. So she ends up in her research finding that 50% of the SIDS cases happened within 2 days of getting a vaccine. Mm. So 2 days plus or minus, they were 50%. 50%, that's half of the babies had just had a vaccine within 2 days. Then she estimated that half of the 250 SIDS cases that she investigated happened 2 days after, and 70% of the SIDS cases happened within 1 week. 70% happened within 1 week of getting a vaccine.
So it's pretty much almost all of them.
So the vast majority, yeah. It's standard practice, when they're doing these investigations, standard practice for them to ask, when did the baby last see a doctor? Were they healthy? When was the last time they took any medication? Have they been eating and drinking well? All of that kind of stuff, right? Those are pretty common questions that they ask for every SIDS investigation. Vaccines are never mentioned on any of those forms. They're not mentioned on any of the forms. They're not mentioned on any of the final reports, and they're never have been listed as a contributing factor in their death, on their death certificates. Not at all. They ask them what they had for breakfast 3 days ago. They ask them if their poop is green or yellow, or, they ask you all of those things. They don't ask anything about the vaccines. This lady was just putting all this stuff together herself. And she came to the conclusion that it's because vaccines are pharmaceuticals that carry no liability. There's nothing you can do about it. No. You're signing a waiver to give your kid a vaccine, and you're signing away everything that says, if something happens to your kid, you can fight us. Yeah, and you're left with no fight.
That's the thing that they don't tell you, right? Is that when you consent to it, because you're trusting the science, that then you have no leg to stand on when something happens. Mm-hmm. So your child can, and when we say sudden infant death syndrome, we're talking about they didn't get a fever. They just stopped. They weren't going through any type of a sickness, cough, anything like that. They were a happy baby. And then they went to bed and they didn't ever wake up.
Right.
That's typically how it works. You put them down for a nap, and then you go to get them, and they're dead. Yep. And that's why most mothers now have literal panic attacks trying to put their babies down for a nap, and they just sit there and stare at them through their monitors. I mean, if you've ever seen a new mother with their baby monitor,
we had the kind that you lay the baby on, and it measures, remember that Angel Care monitor or whatever, and it measures his breathing. And so then if he stops breathing for a certain amount of time, this alarm, let me tell you about this alarm. It went off one time, and it's because he actually rolled off of the pad. Yeah. It wasn't anything dramatic, but it was traumatic because it was like 3 o'clock in the morning, and we were up like,
traumatic. I
disagree. What's wrong with the baby? Anyway, he ended up being fine, but we had a bit of a fright.
Yeah, but
and
they
Rick
don't.
gets real weird when he gets scared in the middle of the night. Fun fact.
Do not scare me awake.
Real weird. Do not scare him in the middle of the night.
Unless
but wake him up very gently and
unless
calmly.
you're ready to fight.
Yeah.
But yeah, I mean these poor parents, you know, and,
Right.
and then knowing that there is no recourse to that, and nobody's talking about the fact that somebody talked you into taking something that was safe and effective for your child, and that thing ended up killing your child because they don't even ask the question.
Right.
You don't even get to know that.
Yeah.
Unless you got some, you know, bulldog of a investigator that's like, hold on a second.
Wait.
And starts asking these questions.
I mean, what's the thing that you hear the most? She said when you start investigating these, what's the thing that you hear the most? And it's basically, we were just at the doctor and they said he was perfectly fine. We just saw the doctor a couple days ago and she was doing great.
Yep.
No problems. It's always that case. It's so crazy. And the last nail in the coffin, and I'll get off this particular soapbox, but is the fact that these deaths are clustered around certain weeks of a baby's life, right? So there's a cluster of them around 2 weeks. There's a cluster of them around 6 weeks. There's a cluster of them around 8 weeks.
Yeah, I wonder why.
What happens during those time frames is you're taking your child to those well baby visits that you have to go to, and they're getting vaccinated.
That you have to go to, or you're a bad parent.
Or you can't put them in public school if you don't get them vaccinated without signing away all this other medical. You're either doing a medical exemption or you're doing a religious exemption or whatever.
Yeah, been there, done that.
Been there, done that. Yeah. We're well versed and we're not doing this stuff anymore. We're not doing these vaccines anymore because we personally have a child, our beautiful 8-year-old son, who is on the spectrum pretty severely.
Yeah.
And I have no doubt he rolled over at 6 weeks. Like he was doing really good. And right around his 8-week checkup, he was kind of never the same.
Yeah.
It's almost like you saw a little bit of light go out of his eyes. I don't know. I can't explain it, but I know that that's what happened. I just know it.
There's a video online of this couple that takes their I think it's twins, takes their twins to the doctor, and they said that you can physically see the changes in their face directly after their vaccines.
Yep.
And they got those, I don't remember which ones they were, but they got those vaccines, and it was, according to them, it was noticeable. And you could see it on their face immediately. And there's no way.
Heartbreaking.
There's no way that both of those kids, if they were twins and autism is what they say it is, where it's hit and miss, which it's not, but they say it is hit and miss, then why did it hit twice? You know,
right. At the same time.
Why when our boys were growing up, we knew kids, 2 brothers that were both type 1 diabetic.
Right.
Like, there's so many
statistically kids, that's nearly impossible.
Yeah, there's so many kids that are so much different now than what they were.
Well, before. We're the sickest country that we've ever been right now.
Yeah.
Even with all these modern medicine and advances in medication and advances in, the medical science and all of that, like we're a sicker nation than we've ever been.
Unless you're Amish.
Right. Ugh.
And then there's
maybe that's where we went wrong.
Well, and then there's
I bet you they're not paying $25 for an 18-pack of eggs right now.
They have 0 autism.
0. And they had 0.
That's a bad sign.
That's a weird. We're going to go with
They have 0. We're going to go with this. Let's close those up.
Let's close
they have 0 autism. They have any of that other stuff, cancer, all of that stuff. It just skips these people. They just God just loves them so much that they don't ever get sick. Is that what it is? Or could it also be that they don't take any vaccines? They don't participate in the regular pharmaceutical.
They don't take unnecessary
They don't
antibiotics.
go to the hospital.
They don't give Tylenol for a fever. All the things that we just do knee jerk. We just do it instinctually. Like, oh, so-and-so's got a fever. I have some Tylenol. Here you go.
Yeah, we
just do it instinctually. I have purse Tylenol. I have car Tylenol. I have house Tylenol. That's just normal. Or
that's why we're not judging anybody, because it's like we've all fallen for this. You know, I have friends, because I was super anti-vax, all of them really, but recently, somewhere around 5 years ago, I was really anti-vax.
This week, 5 years ago.
Yeah, this week-ish. But I also have friends that are really good friends that took it, family members that took it. And I'm not mad at them. You know who I'm mad at? I'm mad at the people that lied to them, that told them.
Propagandists?
Yeah, the propagandists. In my opinion, it was one of the world's, outside of Flat Earth, it was one of the world's biggest PSYOP operations that they've ever done. Mm-hmm. And people fell for it, hook, line, and sinker.
Certainly on that scale, worldwide.
Worldwide. We're not talking about like a 9/11 where you're just fooling America, right? Pretty much. I mean, you fooled the rest of the world as well, but that wasn't.
But really it hit hard with the Americans. Yeah,
the goal was the Americans, but we're talking about a worldwide pandemic that is going to mess with all global politics, mess with all global, because the mandates weren't just in America. They were in Canada. They were in Japan. They were all over the world. So, I mean, if you're thinking, how do you take control? Here I go. How do you take control of a whole globe at that scale? Like that's
globe?
Oh, sorry. Yeah. Oh. You know what I meant.
Busted.
The whole realm, right?
The realm, there you go.
You fooled the whole realm so that you can make more money, because how many millionaires and billionaires were made during that time? Look it up. These people were changing their economic status. This is basically the equivalent of making the whole medical system back in the day. What did you say, 1901?
1910.
I mean, this is the same thing. That was a PSYOP. And
they changed medical treatments. They changed protocols.
Yeah. They psychologically messed with your mind. They came up with a protocol that had nothing to do with anything. And they said, this is the new thing. This is new science. And now everybody has to follow it and pay us a lot of money, obviously. But obviously.
Well, so as we're transitioning and trying to turn to more natural remedies around here, maybe you guys, all of this information is out there. Do your own research, figure it out for yourselves. If there's something that you're not comfortable with and you just feel like, I don't really want my kid to do this, don't do it. Don't do it. That's the bottom line. And it's really hard when your kid's got a fever to not give them medication. It's really hard when they've got a cold to not want to give them all the Tylenol cold medications. I mean, it's hard.
Yeah.
But do more natural stuff. Do the bee pollens, the echinacea, the elderberry, the vitamin C, vitamin D, zinc, and in a pinch, if they are, getting very ill, I've heard, and Rick could probably speak on this for days, a lot of evidence-based information on a 5-day dose of ivermectin. Mm-hmm. Rick takes ivermectin every 6 months or whatever, 3 months. I don't know.
Unless I feel like I need it more.
Yeah.
But I mean, ivermectin, that was like a dirty word about 5 years ago. You weren't even allowed to say it. You had to use hushed tones. But when you think about it, we're vaccinating. I'm not vaccinating. We're giving animals dewormers, right? Our pets, we give them dewormers. We take them to the doctor, give them dewormers. We give our farm animals dewormers. Because why? Because they get worms. What makes us think that we don't get worms, that we don't get parasites? Like, how is it that they're getting parasites, but we don't get any parasites?
Right. And ivermectin is not just an anti-parasitic. It also acts as an antiviral.
Yeah.
So if you do have the flu or something like that, and you're not making any progress, you're not getting any better, maybe see if your doctor will do a 5-day dose of ivermectin and see how you do with that, because
it's cheap.
It's cheap. And most doctors will prescribe it now that we're a little removed from that 2020 situation. Mm-hmm. Some of them still won't, but
there's look around. States that are trying to get it over the counter. There's actually a couple of them. I don't remember which ones. They've already approved it.
Because we can buy it over the counter for our pets.
Yeah.
No problem.
I mean, just get that horse variety. It's fine.
I mean, Rick says the apple horse paste doesn't really taste that bad. So
no. If you eat it with an apple, you don't even notice it.
Put it on an apple, you don't even taste it.
Yes, ooh. America, I deworm myself. Ooh. You have to deworm yourself. Yeah. I mean, if you think that you're exempt, if you live on this realm and you're exempt from getting worms in any way, shape, or form, you're lying to yourself. Because there's all kinds of bugs and fleas, and maybe you didn't cook your meat all the way. Maybe it was packaged with worms.
Maybe the restaurant you ate at didn't handle their food properly.
Yeah. People get worms all the time. But
I got worms.
Worms.
I had to. It's from Dumb and Dumber.
Yeah. So I guess what we're saying in this one, as we start this kind of medical series, we'll start talking about more about financials. We'll bring you a lot more facts, a lot more things that we've read, things that people are posting, because this is a hot topic nowadays for people, because, a lot more people are wanting to take their own life into their own hands.
Right.
And really,
they want their own autonomy back.
Yeah. If you think about freedom, like, that's what freedom is. Yeah. That's what the forefathers were fighting for. They weren't fighting just to be free from the crown. They were fighting to have their own sovereign autonomy and not be under a crown or under anybody. Yeah. They wanted to rule themselves. That's why when they wrote the Constitution, it was we the people. Mm-hmm. That's why the people in our government are in charge, because they wanted this autonomy where they thought for themselves. They said, this is the medical treatment that I'm going to do because it's been proven to work for thousands of years, and because it's God's design. They believed in God. They believed that this stuff worked, and so they did it. And they wanted the autonomy to be able to do that. And that's what we want. And we want that for you guys. And we want you to want that for you. So when Kristin says you can do something about this, we know. I've fought with many doctors, as I said. We've filled out all the paperwork. We've done the religious exemptions. Yes, it is more work. Yes, it is stupid and obnoxious. But you still have to do it. If you want that freedom and you want that autonomy, freedom isn't sitting on the couch hoping that something is going to be done about it, because it's not going to be done. Right. Nobody has your interest in mind better than you. So take that authority for yourself and say, you know what, when the Bible says take dominion, it doesn't mean to just free willy let everybody do whatever they want to you. It means take dominion of your own life, your own autonomy. You are you. And he gave you a brain and a sound mind and all of those things to be able to make these decisions. He gave you the Holy Spirit as a helper to guide you through it. And, you can do these things. We believe in you.
Let's flip that Rockefeller quote from, he doesn't want a world of thinkers. He wants to think a world of workers. Let's flip it. Let's say we want a world of thinkers.
Yeah.
I mean, come on.
Here on this podcast, we don't want a world of workers. We want a world of thinkers. All thinkers. Why am I doing this with my hand? Like,
I don't know. You got really
I got very aggressive with the fake gun. I don't know. It was
very biggie.
If anybody started to feel, a little nervous there, it wasn't real.
It's fine. He's holstered
2 fingers is
Put
real.
It away.
One finger is just, it's more of a wrap,
It's baby smalls. Okay.
Yeah, you got it.
Got it. All right. Well, we had a great time with you guys today.
Yeah.
Send this podcast to other people. I'm sure it was rambly and maybe your eyes glazed over for a little bit, but that's fine.
Yeah.
It happens to the best of us. My eyes probably glazed over 10 times.
Just when I was talking, but yeah, we get it.
No, send this to people. Get the word out. The more that people question this kind of stuff, the more progress we make collectively as a group of people. Because if you tell people that you're not vaccinating your kid anymore now, as opposed to 10 years ago, they're going to think you're a little less crazy than they did 10 years ago, which is progress.
People are waking up.
Progress in the right direction.
Yeah, they're not falling for this stuff much anymore. Yeah. I mean, the good thing about that PSYOP that happened 5 years ago and is continuing is that people are calling bullshit bull honky.
Bull honky said the donkey.
Bull honky said the donkey. They didn't want any more. They were like, you're lying. You're actually lying to me right now. And I know that you are.
Right.
And so people are waking up because of that.
Yeah,
so
I
in
agree.
a good way, maybe it shook you a little bit. It shook you awake. And now it's time to do something. So hopefully you can. Hopefully you enjoyed this episode. And hopefully you come back, because we're going to have a lot more on this subject.
A lot.
All right. But until then.
We promise to not glaze eyes.
Yeah.
We're going to write a rap. Rick's going to write a rap song called Eyes Are Glazed.
Glazed Eyes. All right, you guys, that's it for us. We are That's So Fringy Podcast, and we will see you on the next one.
Bye.
Glazed Eyes. Glazed Eyes. Yeah. Let me see. Glazed eyes. Big thighs. That's all I got.